Hello, Abid. How are you today?
I'm good.
Okay. My name is Sanjay. I'm a student and I was going to look after you this afternoon. My AIN said that you got a bus you want me to see. Um, how can I help?
I have a lot of pain.
Okay, you got a lot of pain. Before I proceed and look your documentation, can I quickly check your identity, please? Can I get your full name, please?
Maria Nadi,
Mariam Abid. And can I get your date of birth, please?
7 January 69.
Okay, and your MRN 174963, which is correct. Abid, have you got any allergy?
No, I don't have.
You don't have any allergy, that's good. Okay. I was going through your notes and I realized that the doctor have prescribed some pain relief for you. Can I quickly ask you how severe is the pain? 0 being the no pain and 10 being the very worst.
It's probably 8.
8, so you got a lot of pain. Would you mind to tell me where you have a pain?
My chest.
On your chest. Okay, because you got a rib fracture, so that causes a lot of pain. I do understand. What I'll do is I'll go through your notes and realize that doctor have ordered PCA morphine, which is a patient control analgesia. You have control over your painkillers, which I will explain it to you later on. I will go. Is that okay if I go and get all my medication ready and I will come back to you in about 5 minutes?
Okay.
No worries. Thank you very much. Would you like to be my second RN for the validation of the order, please?
Yes, sure.
Okay. I got a patient named Mr. Abid Mariam. His MRN number is 17496. Date of birth is correct. I checked against his armband. He does not have any allergy, and he got PCA medication charted, morphine, 50 milligram per 50 mils, and the protocol is concentration is 1 milligram per mils, number of syringe per 3, dose as a PCA once only. Lockout interval is 5 minutes and maximum dose is 12 milligram. Doctor have initial and it's been charted by Dr. Lian Health and this charted this morning. So are you agree is that the valid order? And doctor have also put some anti-emetic and naloxone to cover up the side effect for the drug.
Okay.
Are you agree?
Yes.
No worries. Okay. Would you like to be my second RN for the taking the morphine out of the acid cupboard for me, please?
Sure.
Okay. So, doctor have prescribed 50 milligrams of morphine in the 50 mils, and I will go through the maximum dosage and all, so to make sure that it is correct. Okay, morphine. So the morphine, it's opioid analgesic, and the maximum dosage is for the PCA is 1 to 1.5 milligram for adult. So we got the morphine concentration is 1 milligram per mils. So and it's based on the body weight, and it got a side effect of respiratory depression, apnea, cardiac arrest, GSGI. Is that okay?
Yeah.
Okay. And I have gone through with the. I have also gone through with the injectable MIMS and realized that normal saline is compatible with morphine. So it is okay to dilute the morphine with the normal saline. Okay. Because is this is the SA drug cupboard. We'll get check for against. Okay. Okay, we got the morphine. I will check. Morphine sulfate, 10 milligram per 2 mils, and it says we got a 20 mils. So I'll just quickly calculate the dosage. Okay. Okay, so I'm going to the calculation based on the stock. We got 10 milligram per 2 mils, or we can say as a 1 vial. We require either 10 mils of morphine or 5 vials of morphine. Let's check into the drug cupboard what we have. Alright, proceed. We need to do the hand rub, touching the morphine. Morphine sulfate 10 milligram, morphine sulfate 10 milligram into 2 mils. So we got morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate 10 milligram, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Morphine sulfate 10 milligram, 10 milligram, 10 milligram. All of that, the 10 milligrams into 2 mils, which is 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay, so all the morphine sulfate, we got 20 as per the record, which is correct. Now, morphine sulfate, all of the morphine sulfate are expiring 10 of the 20th. So I see the morphine sulfate, 10 milligrams into 2 mils, which is expiring 10 of the 20th, 10 of the 20th, 10 of the 20th, 10 of the 20th, morphine sulfate 10 milligram, 2 mils, 10 of the 20th. So all the morphines are within the expiry date. Similarly with this 10, which we require, is also expiring 10 of the 20th. Okay, so now we require the morphine 5 vials, so balance will be 15 vials. So I can put today's date. 5 is 16, 15. We got 20 in ward stock, and I am taking 1, 2, 3, 4, 5 out and putting the 15 into the bag. So we got morphine sulfate 10 mils into 2 gram, 1, 2, 3, 4, 5. All are expiring 10 of the 20th, so which is 5, and morphine sulfate into 10 mils into 10 milligram into 2 mils. All are expiring on 10th of the 20th, which is 5 of those: 6, 7, 8, 9, 10, 11, 12, 13, 14 and 15. So 15 balance back into the drug cupboard, and I'm locking this drug cupboard. If you are agree that I have taken the 5 and the balance is 15, would you like to put your name and sign for the verification, please? Okay, so the asset register has been filled up with the correct balance left. Alright, would you like to be my second RN for the first drug check for me, please? I got all the instrument ready. I got a patient. His name is I did Miriam. I have cross-checked his identity against the armband. He does not have a known allergy. Has been prescribed 50 milligrams of morphine into the 50 mils. And this is my calculation. As per my calculation, the ward stock was a 10 milligram into 2 mils. Either we require 10 mils or 5 vials, which is equivalent. So I got and it's for the PCA, and it's been charted today. So I got a morphine sulfate 10 milligram into 2 mils, expiring on 10th of 20th. So 2 mils, 2 mils, 2 mils, 2 mils, 2 mils, 1, 2, 3, 4, 5 vials, or 10 milligrams all up, which is makes a 50 milligram. It's for the PCA for Mr. Adil Mariam via patient control analysis. Yeah, is that correct? Okay. I also got sodium chloride, which is 10 mils, and the expiry date is September 18. So I got 4 vials, 10 mils, 10 mils, 10 mils, 10 mils. It's for the dilution of the morphine. As per the doctor charted, we required, I can calculate, which is 10 mils morphine plus 40 mils anesthetic is equal to 50 mils. So we got 10 mils sodium chloride expiring on September 18. It's for dilution of the morphine. 10 mils into 1, 10 mils into 2, 10 mils into 3, 10 mils into 4, all are 40, plus 10 mils of the morphine, which makes a 50 mils. All are expiring September 18. Is that correct?
Yeah.
No worries. Not a problem. Thank you.
So the balance will be 15. And then on the person, what's her name? Just John something. Yeah, and then signature. What are we gonna put there? Yeah, that's it. Okay then. So
we need to do it here.
have you done the right way?
15 amount.
You're gonna receive from pharmacy?
Yes, that's right.
That's okay. And then we start record on the second line. Okay.
Actually, if you transfer it from a page to another page, all you have to do is just put it on there. That's all right. So to let it, okay.
Just leave this.
Just leave it as it is.
Okay.
Now,
No, so that's alright. And then you start record from second line. So you do. Yeah. So that's it. You wanna put this on that?
yes, that's the bonus. Yes, the patient is.
Okay. Would you like to be my second RN for the second drug check, please?
Now I will be taking the clients.
Okay.
I will be looking at the
I got the patient. Name is Adib Mariam. I have checked his identity against his armband. He does not have any allergy. He has been ordered a PCA morphine 50 milligrams into the 15 mils. The dosage are here. It's been signed and dated by the Dr. Lian Hunt, which is this morning, so it is a valid order. And I got here 40 milligrams of sodium chloride. So the 40 sodium chloride 10 mils into one vial, September 18. So sodium chloride 10 mils and expiring September 18. Sodium chloride 10 mils, September 18. Sodium chloride 10 mils, September 18. So 10 mils, 20, 30, 40 mils. So I got the 40 mils of the normal saline into the injection to dilute the morphine. Is that correct? Okay. Now, for the PCA, I got the morphine sulfate 10 milligrams into 2 mils. Sodium morphine sulfate 10 milligrams into 2 mils. 2. So morphine sulfate 10 milligrams into 2 mils. Morphine sulfate 10 milligrams into 2. 4. Morphine sulfate injection 10 milligrams into 2 mils. So all up adding 10 mils, and it's a mix 50 milligram, and all are expiring on 10th of the 20th. Is that correct?
Yep.
Okay.
I'm gonna take it. So morphine sulfate 10 milligram to ml, 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 and expiry date is 10/20, 10/20, 10/20, 10/20, 10/20. Okay, now I'm gonna record in acid drug book. Today's date is 21/17, and the time is 16:24. As in is balance is 15 minus 5 is 10. This person is
would fill out my additive labels now. Okay, would you like to be my second RN for the final drug check for me, please? Third drug check? Okay. I got a patient. His name is Abid Mariam and his date of birth is 7169. And I have checked his MRN number against the armband, which shows all the details are correct. He doesn't have any allergy. He has been ordered 50 milligram of morphine into 15 meals. So I got the 50 meals. Is that correct? Okay, which contains a morphine as well as this normal saline. So this is the morphine. So the morphine sulfate 10 milligram into 2 ml expiring on 10th of 20th. Morphine sulfate 10 milligrams into 2 ml expiring 10th of 20th. Morphine sulfate expiring on 10th of 20th. 10 milligrams into 2 ml. 3. Morphine sulfate injection. Morphine sulfate all are 10 milligrams into 2 ml, and all are expiring 10th of 20th, which makes a 10 milligram all up. And I have used the normal saline vials, 10 ml vial, to dilute the morphine. So I got the sodium chloride 10 ml expiring September 18. 1 sodium chloride 10 ml expiring September 18. 2 sodium chloride 10 ml September 2018. Sodium chloride. So all up is a 40 ml plus 10 ml of morphine, which makes 50 ml. And I have filled out my additive labels, which got the personal detail for the patient, as well as a morphine filling 15 milligram into 15 ml. It makes 1 milligram per meals. Sodium chloride 0.9%, and date is today's date time, and I have signed it, which the concentration is matching with the doctor has prescribed. If you are happy, I would like you to sign it for me, please. Okay, so are you happy with my third drug check?
I'm happy with that.
Now I'm going to prime my line to make sure there is no air bubble into the morphine concentration. Okay, so my line is primed and there is no visible air bubble or anything.
Yeah, it's clear.
Clear. Okay. How are you, Abid? I got your medication ready, and I'm with that. I got all the instruments and everything, which will help you to do the medication. But before I give you the medication, I would like to check your vital signs, which is blood pressure, respiratory rate, and everything. Have you got? I will check it, but before I do that, I would like to check once again your identity. Can I quickly get your name, please?
Mariam Latif,
Mariam Abdi. Yeah, and can I get your date of birth, please?
the 7th January 69.
Yeah, and your MRN number 174963, which is correct. And Have you got any allergy?
No, I don't have.
Okay, now I'm going to check your vital signs prior to the introducing your PCA morphine, which has a respiratory depression. So I want to make sure that I get a picture of your baseline data. So if anything goes wrong, I know that we got correct data for you. Okay, have you got any question before I proceed? Okay, I've checked your vital signs, all looks within the normal parameters. Okay, now I'm going to put the introduction. Okay, and so now your PCA machine is on, and I would like to make sure that I'm giving the right thing. Okay, we got the order the morphine. And I will set up the dosage as per the doctor have charted. So concentration is 1 milligram per ml, PRN dose, 5 minutes lockout time, and maximum is 12 milligram. Okay, so I'm going to alter the data. This machine shows a 60 milligram per hour, which we require only 12 milligram per hour. So I'm going to make sure. Okay, all right, so I got my protocols as per the doctor charted. So now which is correct, and I can turn on. Okay, a bit. Just I quickly assess your cannula side. Can I quickly ask you when this cannula been inserted?
It was inserted yesterday.
It looks nice and intact. There is no signs of redness or inflammation over there. To use alcohol swab for your cannula side to give a good 15 seconds scrub to make sure there is no information, so it's clear. I'm going to connect. So I will wait for 15 seconds and I will connect it to the cannula, and I will make sure it's been I want to make sure it's been secured. Alright, so Abid, this is a PCA control remote. PCA control means it's a patient control analgesia. It is ready to go into your body, morphine. When the green light is a light green in color, that means it is ready to insert. So you can press it once and there will be 1 milligram of morphine will go into your IV line, and you have a 5 minutes waiting period to take the dose. So you wanna try once. Yep, you can press that one and you will hear the beep noise. That means the dose has gone. Did you hear the noise? So once there is a blue lights, the light is flashing, that means it's a lockout time. You cannot insert the morphine again for next 5 minutes. Have you got any question?
No.
Okay, I'll leave this remote, PCA remote to you, and I'll get the bed remote with you as well. So if you need any help, you can press the buzzer and I will come. But I will be coming back in the next 15 minutes to check on you, how you go, and make sure that you are happy. Okay? Okay, I will come back in 15 minutes and I will check on you. Alrighty, I will dispose all my equipments. Okay, would you like to be my second RN to sign the medication chart for me, please? Okay. So today's date is 21st 3/17, time is 16:30, and that's my signature. If you are happy, can you please sign it? Thank you very much. See you later a bit. I'll come down after 15 minutes. Thank you.